Well, welcome. Thank you for joining us today. Sanjeev and I will run this webinar. As with all of our webinars, we like to keep them as interactive as possible. The reason we do that is we've learned over the years that you will have specific questions that you need answered, and by asking those questions, it enables you to understand where our tooling starts and where it stops, which is super important. What we'll do is we'll run through the presentation, and if we ask that if you have any questions, please pop them into the chat, and we will take periodic pauses, go through the questions, and then we'll circle back, continue with the presentation, and then at the end we'll have we'll allocate some time to some more questions if we have them. Please don't be shy with the questions, just pop them in. They are a positive. Everyone can learn from the questions that everybody asks, and they are the best way to make best use of this time. We've scheduled an hour for the webinar. If we complete sooner, we'll wrap up sooner, so you can get some time back to your busy days. So we'll start with the official bit done. We will start with the webinar now. This is our deck, which we'll run through. You should have had a copy of. Hopefully you've been shared a copy of the deck. We have another spreadsheet that we'll run through, which has about 181 different pathology tests that some of our clients have given MyBotGP permission to look after for them. We have 200 different pathology tests now being managed by this platform. We've even got some clients who've got 2 labs. So for them, there's somewhere in the region of 300 to 400 different pathology tests it's managing for them. And we unbelievably have one client that has 3 labs. So three path test results for the same path test. So MyBotGP is actually managing somewhere in the region of 400 to 600 path tests for them. This tool, MyBotGP is the range. JIFJAF is the company. MyBotGP means it's a product built specifically for primary care. We have 2 core products for EMIS, which is our pathology management platform and a document automation management platform. And for SystmOne, we have 1 core product at the moment, which is the pathology management platform, and we will be releasing, hopefully later on this year, an equivalent for letter management. So today we're going to go through the intelligent pathology automation platform, which works with both EMIS and SystmOne. The tool works in an identical fashion for both systems, whilst there is a slight difference in functionality within EMIS and SystmOne on where messages are, where path tests are pushed and stuff like that, but it remains the same. We'll have a police car going past. Just wait for that to pass. Thank you. So MyBotGP, it's an intelligent automation platform. The principle behind this tooling is to free clinical time and to enforce standardization where appropriate at practice level, and increase essentially patient safety by enforcing additional checks on all pathology tests. MyBotGP is a medical device. It has a DCB 0129 certification, which is an NHS certification. We've also taken the time to draft a templated DCB 160. For those of you that would like a copy of that and acquire the tool, you're more than welcome to that. We can explain what that is a bit later on. We are also an NHS ICT partner. We are a private UK business. We're not an NHS organisation, so it is unusual to have a partnership with an NHS ICT, but we do. What that means is MyBotGP lives in NHS cloud, so DTACs, DPIAs, data sharing agreements, all that type of stuff aren't a challenge for us. We can just plug you in. So not all normal pathology tests are normal for the patient. Clinicians are checking these manually. What does that mean? Well, we'll unpack that now. The principle behind our tooling and what we've seen through our client base is we can give back up to 30 minutes a day for each clinician, for every clinician in a practice. So if you have 5, it's 5 times 30, 4 is 4 times 30, 10 is 10 times 30 minutes a day. What do you want to do with that time? We can focus on other work essentially, and reduce practice cost allocation and improve safety through enforced additional checks. So what does that mean? So the business case for this product, we do just for demonstration purposes on a list of about 8,500 patients. Okay, so just for the premise of this, the numbers here relate to a practice that has 8,500 patients. Now, on average, a list with 8,500 patients will have approximately 5 partners. We had a client a call yesterday with one practice that had 2. They're working particularly hard. Most will have approximately 5. Okay. Now, an 8,500 list in the UK at the moment generates approximately 62,400 pathology tests a year. So just under 62,500 pathology tests a year. Now, a practice of half that size, we've seen through our client base, could be validated now, will receive approximately 50% that number, and a double the size will receive about double. It does scale up and down. So that's 62,500 pathology tests a year, which essentially are a continuous clinical workload that are all being managed by the partners. Now, within that 62,500, approximately 80% of those are normal, which equates to just under 50,000 pathology tests. But again, what is normal? A lab sending a path test back to a clinician or a practice saying that this path test is normal does not take into consideration patient context. It's not their job. Their job is to take the sample and to come back with a reading, normal or abnormal, or put alerts or keywords or whatever in order to show what they've found. So what that means is from the 80% of that 62,500, which is about 50,000 tests for an 8,500 list, around 20% of those normals require additional manual contextual checks on the patient before safe filing or flagging. So what do we mean by that? Well, what we mean by that is the team are physically filing normal tests that do not require further investigation and physically running patient contextual checks on thousands and thousands of tests a year to look for percentage increases, decreases, health conditions, medications, superseding lab ranges to determine whether that patient requires further exploratory work. And then either filing that path test because it's come back negative, or being made aware of it so they can continue their exploratory work to see why the patient came in the first place and to see if they can help. So based on this 8,500 list and 5 partners spending 1.5 days a week, the practice clinical capacity cost allocation is about £50,000 a year. And that's what it's costing the practice to do this task. And essentially, this is what MyBotGP is built to support and remove. So manual processing, obviously, in addition to that, leads to variability, backlogs and errors. All of that disappears when you start using our tooling. Here's a bit more on the numbers, and then we'll get to the interesting stuff around the rules and the logic and how it actually works. But that's 1.5 days a week of clinical capacity, which is 95 days of clinical capacity reclaimed by the practice through using this tool, and cost. In addition to that, additional safety, because nothing slips through the net. MyBotGP can also send text messages, obviously. So how it works, it plugs directly into EMIS or SystmOne. So what that means is if it does file path tests and you want to put messages on there, comments and filing strings, they remain the same. So when patients log into their app, they can still see everything in exactly the same way. Think of it as a big security filter and time-saving filter that sits at the front of the practice. All path tests will pass through MyBotGP. You can bespoke the rules that you would like to use to vet those pathology tests. So what that means is different where we work with PCNs and there are PCN acquisitions, different practices have got different approaches to validating them. You are not stopped from doing that. You can still bespoke this to apply your rules in the way that you see fit. So think of this big security filter at the front of the practice. All the path tests pass through it. Now, when you get the labs back from the path tests back from the labs, they sit in 3 buckets. Obviously, you have normal path tests that do not require further investigation. Okay, so that comes back as a lab from normal. Don't need to do anything with it, can just file it. You have normals that require patient contextual checks, so that comes back from the lab as normal, but you know that if it comes back as normal from the lab, if the patient has got a particular health condition, or if it's gone up or down by a certain percentage, you might want to see that path test. So that will be flagged for you. So MyBotGP will make sure that you don't miss that. So prostate that's gone up by 4% since the last test, you might want to see it, or you will. Even if it's come back as a normal, it's not going to slip through the net. And abnormals. So checking over 200 different pathology test types, MyBotGP automatically checks all of the path reports, files tests that do not need it, and performs the additional patient contextual checks as determined by the practice. We'll cover that in a moment, and then either files them or flags them based on what you want to do. So there's additional safeguarding in addition to the time saving, and it will decide file, send a text message or not send a text message. So we move to the next slide. So here are the rules. So here are the rules that can be combined in any way. So it's not one rule per path test. You can combine these rules on path tests. So first rule, range control. So what does that mean? So what that means is, do you agree with the lab? Okay, or do you disagree with the lab? So it sounds quite straightforward. So there are lots of path tests that come in that our clients do not agree with lab ranges. They want to supersede the lab ranges. So you are able to do that. Prostate as an example, EGFR, a lot set different ranges for some of the subtests in full blood count. And the reason they do that is because they either want to supersede the lab ranges to class something as a normal or an abnormal, and they disagree with it. So do you agree with the lab or supersede the lab? Next one, and the two are linked together. Do you need to check for a health condition or medication? So MyBotGP will check in the patient record and say, yeah, this has come through as normal. This particular client says I have no issue with this test coming in as normal, as long as, and I'm happy to file it, as long as they don't have a health condition. And MyBotGP will go in the patient record and do that. Would you like the tooling to check against the previous test result? Smart comparison for a percentage increase or decrease. So exactly as it says, a path test can come in and you can say, I'm happy to file that as long as it hasn't gone up or down by a certain percentage since the last test, and you can determine what the increase or decrease is, and MyBotGP will do that. For example, you could actually supersede the lab and check for a health condition and look for a percentage increase or decrease. So these rules knit together, which is why our tooling is looking after so many different path tests now. Do you want to supersede in terms of age or gender? Exactly as it sounds. And now the other thing that our tooling can do is it can also read the path test report. So that's quite important because there are thousands of path tests that you get that essentially don't have ranges. So you want to look for keywords, positive detected, and warnings, perhaps like HbA1c might say pre-diabetes. So you can actually read the path tests as well. So you can say, I'm happy to file this as long as you don't spot this warning, or I'm happy for you to file this or flag it as long as it doesn't say detected or not detected or positive or negative. You can exclude patients, obviously. And there's a full audit log. So you have a very comprehensive audit log. Anything that it's touched, there will be a copy of. And you will still have the same audit in EMIS or SystmOne, depending on what system you're using. So you actually have a double audit. And if you would like to send patients a text message, you can, and it will use Accurix in the same way. So all of the same messaging that you like to use will still be used. So an example that we like to give for here, where you can see different practices have used different approaches, is prostate. So for prostate, the bulk of our clients now supersede the lab ranges, and they put 5 different age ranges and 5 different PSA readings. And then they put an emergency safety in there to check that the patient hasn't had cancer or prostate cancer or metastatic prostate cancer. So what they're doing is they're saying to the lab, and we'll show the example, someone in their 70s won't have the same reading as someone in their 20s. This is the reading we would expect. I don't want to see that as a fail if it's not a fail. However, if they've had cancer, I want to see it anyway. Other clients for prostate say, no, what we want is we want to have a default normals test range. Anyone that's outside of that is a fail. But anyone inside of that, I want you to check against the previous test result, and has it gone up by more than 3% or 5%, for example, because that's too quick. And if it has, I want you to flag it. And this is where the bespoking comes into action. A lot of our clients supersede a lot of the cholesterol ranges, and we'll come back to that in a moment. So this is what the interface looks like, the front page. This is yours. You will have your own copy. There's no limit to the amount of path tests you add or volumes, and you can log in and out of this whenever you like and change any of the rules whenever you like. That's really important because at different points in your time using the tooling, you will want to add or remove path tests, or you might want to change the rules around that, or your lab might change some ranges, and you can log in within a couple of minutes and just adjust it as you see fit. So this is quite a small picture, so I'll explain it quickly, and then I want to share a spreadsheet with you all in a moment, and we can talk through that and then maybe pause for some questions. So let's say, for example, this is actually a liver function test. So let's say this is a client and this is what their lab has said are the ranges for a liver function test, and we can see them here. So you would simply look at this and the first choice would be, do you agree with the lab or do you want to supersede the lab? Basically, are you happy to file this based on those ranges from your lab? And do you need to run any additional checks? If the answer is no, you're happy to file this and you do not want to run any additional checks, then you'll click here, File for Normal Report. Up will pop a warning to say, just double checking you're aware of what you're doing. You're going to file this. You don't want to see this path test anymore. As you don't want to run any additional checks. As long as all of these sit in range, you're happy to file it. If you press yes, the next time it sees that test, it will file that test if everything is in range. If any one of those is out of range, it will fail it and leave it for you and flag it for clinical review. Now, let's say you don't agree with the lab, or you do agree with the lab, but you want to add additional checks. So you don't click File for Normal Report. And here you can see you quite simply just can click anywhere here and adjust any of the ranges in a couple of seconds. Or you could say, I'm happy with those ranges, but for this particular subtest, I want you to check against the previous test result. You just click yes, and you put the percentage difference in here, and it will do that for you. Or here, we have our keywords. Keywords is a loose definition that we use for any word that it can find. And this is where you can write in health conditions, warnings on the pathology test reports, and so on and so forth. So in principle, with this test, you could quite easily supersede one of the ranges, make it tighter or looser, check against the previous test result, and tell it to look for a health condition if you wanted to, as all of your patient contextual checks, just to lock down that this test doesn't slip through the net, and that it's flagged if you want it flagged because of the patient history, despite it coming back from the lab as normal. And this is where the time saving comes from. The thousands and thousands of tests a year are being, this work is being manually done, in addition to the additional safety, because once you lock this down as a rule, it's always going to do it. Here's a short description, but what I prefer to do, my computer stops, here we go, is open up this spreadsheet here. Sanj, can you see the spreadsheet? Yeah, okay. So what we're looking at here, let's go to the top here. So this is one of our clients has kindly shared this. We will have sent you all a copy of this and happy to share it again. And this is not by no means the final set. We have lots of different versions of this, of the rules on here, which we share with clients when configuring the tool. It takes about an hour to configure the tool. It's not particularly time consuming, and we do that with you. So what you're looking at here is about 181 different pathology tests that one of our clients has given MyBotGP responsibility to look after for them. So the client has given the tooling responsibility to file anything it deems as normal. So file any normals without patient contextual checks that needs them, or file any normals that do require patient contextual checks to perform those patient contextual checks. And if it passes, file them. If it doesn't, flag them. So that's what enabled means. So here, what you're looking at the top is the path test name, subtest name, gender, age, check for normals, ranges, check against the previous test result, check the patient history, and comments and filing strings. As I said before, everything still gets filed in the patient record in exactly the same way, so they can see it in the app. So this essentially has been exported from one of our clients, and what it is, you're looking at the real version of actually how these rules are being used on what pathology tests and how they're being combined. Range control, condition checks, smart comparisons, check the pathology test report, age, gender, send text messages, comments, and filing strings. So again, the first one at the top here, again, not a test you will be applying for thousands of a year, but it's the one at the top, so it's quite nice to show to begin with, is, as you can see, it's called a 24-hour sodium test, and the subtest is 24-hour urine sodium. So this lab is sending our client 24-hour urine sodium test with the range of 27 to 287, and anything that sits within that, the lab is saying is normal. And what we can see from our client is they agree. They haven't asked to supersede for age or gender. They haven't asked to check against the previous test result. So they're happy to file on that basis. However, what they have asked MyBotGP to do before filing is to go off and look in the patient record, and if you look in the top left-hand corner, is to see whether the patient has diabetes or chronic kidney disease. So this is where the additional checking, time saving and safety comes from. So this client is saying, I agree with the lab. I've got no issue with the ranges, 27 to 287. Happy to file that test, but I don't want it filed if the patient's had diabetes or chronic kidney disease. Can you go off and have a look in the patient record, please, and find out? If MyBotGP does not find diabetes or chronic kidney disease, that test would be filed. If you wanted a text message sent, they would do. If you don't, it wouldn't. However, if it does find it, it's going to flag it. It's going to not file it, and it's going to flag it and leave it for clinical review. So the purpose behind this tooling is to make sure that the clinical teams are only looking at pathology tests that they need to look at and want to, and they're not sifting through thousands and thousands a year for no apparent reason. Someone else is doing the groundwork for them. This is the prostate example. As you can see here, this particular client has superseded their lab, and they've put 5 age ranges here: 18 to 39, 40, 49, 50, 59, 60, 69, 70 to 150. And here are the PSA readings: 2.5, 2.5, 3.5, 4.5, 6.5. So they're saying these are the correct ranges for people of this age for this practice. Again, we've got different clients who've put slightly different ranges. However, for safety, again, to make sure nothing slips through the net, look in the patient record and check if they've had cancer, prostate cancer or metastatic prostate cancer. If they have, flag it. And again, other clients use a different approach. They agree with the labs, but they look for percentage increases because they're trying to pick stuff out before it happens. So if something's increased too quickly, they want to be made aware of that so they can invite the patient in and take the appropriate action. Here's an HbA1c example. For this particular client, they agree with the lab. They're using lab ranges rather, obviously, 20 to 41. But their lab gives a warning of pre-diabetes on the path report. But and again, if the patient has diabetes, that would be in the patient record. So what they're saying is, I'm happy for you to file anything that's 20 to 41 without me needing to see it, unless the patient has diabetes or you see a warning saying pre-diabetes. And in that case, I want that flagged. And we could go on. Obviously, we've got lipids, and you can see here there's about 181 different path tests on here. You can see they've agreed with lab ranges, but they've looked for the words not detected, and that's what their lab says. Other clients say cardiac arrest or heart attack. Another lipid here. I'll just show you a couple more, and then we can stop for a moment for questions. Oh. I'm correcting the form here. We go to lipid here. Yeah, I believe it's this one. As you can see here, client has superseded the lab, taken that range to 5, as most people do. However, if you look at the keyword checks in the top here, they want to check in the patient record to see if any of these health conditions have been present, because if they are, they want to see that test, even if it comes through as normal. So our clinical safety officer is a UK practicing clinician. He is who built our DCB 129 and our templated DCB 160 that we will share with you as well. So this tool has been built essentially with clinical input, hence the keywords and the ability to search on the keywords. So most of our clients, they get to add approximately 95% of their pathology tests. That's the target. And then MyBotGP's got the ability to look after up to 95% of their pathology tests for them, and it will do the initial screening and vetting. It will send you a spreadsheet every day confirming what's been done. We have a distribution group for auditing, and obviously within MyBotGP as well, there's a super comprehensive audit log, and we run regular training as well. The onboarding process is quite quick. We can plug you in. MyBotGP will suck up all of your lab ranges directly from the lab, get all of the correct ranges, and then you have a call with one of our team here. Most clients' first call is about 45 minutes, and you'll get the bulk of your path test added. Most clients like to start with 50 or 60, 40, 50, 60 path tests of the most straightforward ones while they build confidence with the tooling. And then a couple of weeks later, book a second call, another 45 minutes to add the remaining path tests on. And then usually by then they're up to 90, 95%. Some of our more hands-on clients do this themselves. It's quite straightforward to do. It's literally, you'll have a list, double click on the path test, open it up, put the range in, put the additional check, press save. So the ones that like to do it themselves can do it themselves, and the ones that want us to do it with them, we do it with them. But we always do the first couple of calls to get them up and running. Path test change as well, super important. The ranges will change and you will change your mind. So there's no limit. You can log in and out every day. So that feels like a good place for a natural pause. I'm just going to mute myself for a second, or last Sanj, is there any questions put in the chat? Are there? Okay, Sanjay saying there's lots of questions. So what I'm going to do then is here. Okay, so let's go through these one by one. Great. Okay, so Sanj and I will answer these questions. We'll go through them one by one. Please pop more in the chat if you want to. And then what we'll do is we'll circle back and we can finish off on pricing and costing and so on as well. So the first question here says, do you find you get different filing ranges, percentages in different regions because of the report text notion differing, or because of the different thresholds for normal, e.g. EGFR 90 abnormal in some labs, not 60? Sanj, do you want to take that? I mean, my initial reaction to that is you would set your own ranges based on the lab. You're not stuck with a national average, Sanj.
Yeah, exactly. The strength of the tool is it picks up the local lab ranges for the practice. So whatever your local lab ranges are, that's your baseline, and then one can decide to go with that baseline, i.e. your lab ranges agree with your local labs, or supersede them and adding in further checks on those lab ranges. So that situation doesn't occur with respect to that question.
Yeah. So thanks, Sanj. So I think that links into how the tool is bespoke. It's plugged in and it will take a copy of all your lab ranges directly from the lab, so you know what MyBotGP is working from.
Yeah, and again, the strength of the tooling is the ability to set your own ranges and supersede, and having the comfort that the tooling is extracting your local lab ranges, not just looking at the next question here. So again, the strength of the tool as opposed to risk, effectively, it essentially allows you to supersede your lab ranges and giving you greater control, which all of our clients are really happy about.
Yeah, so just one more bit on the first question, and that actually answers. So when we onboard, we can show you what different clients have used. So we've got national sort of coverage now with this tooling, whereby there's lots of different approaches used to different path tests. So just for EGFR, by example, I've seen that 60, 70, 90. I've seen it some look for a percentage increase of, I think, 5%. Others look for a particular medication as well. Others don't. And this leads back to the bespoking. So second one, just to recover that out and read it out. So because the device doesn't operate a centralized set of rules and the user gets more local control and flexibility, there is a high degree of liability or risk for the user. What if we didn't adjust the rules as best practice changes? Does the central bot take over and adjust the updated ranges? So the short answer to that is you're interpreting these now and reading them and making decisions based on your path test yourself manually. So this is a replication of what you would do manually. If you wanted to file all normal path tests as they come in normal from the labs, and you would not like to adjust any of the ranges, and you would not like to do any patient contextual checks, then 100% the bot will do that. 100%. It will suck up your lab ranges. If you agree that something is normal, just say file it.
Just to add on that as well, again, another strength of the tooling, it's monitoring the lab ranges. So where they do change, the system flags and tells you that certain path category lab ranges have changed. So again, allowing you as a clinician to whether to agree with those changes or to again override and supersede the changed lab ranges. So it's constantly checking real-time changes for you.
Thank you. So yeah, so in essence, it's a replication of how you would do this manually yourself. So you just want to file, it will just file. If you want to add additional checks or you want to supersede, it can do that as well. It's also important to say, it's a really good question, that we've taken the time and cost to ask our CSO to build out a DCB 160 as well, which we give to all clients. So DCB 160, for those of you that are not aware, is paperwork that you are supposed to complete at practice level or PCN level, and it's around usage of tooling. You will have a DCB 160 for every tool that you use, and having the DCB 160 will essentially completing that will make sure that you are aware of what you're doing. So what does that mean? What that means is, how often do you reconcile? How often do you check? What are the potential ramifications of adjusting rule sets or changing ranges and things like that? It's the second half of the answer to Chris's question. So can you add a medication as a keyword such as finasteride for PSA? Yes, you can. Can a clinical calculation be automated? Someone keeps popping in here. Can a clinical calculation be automated of flags such as a Q risk with lipid results? This is moving into abnormals, isn't it, Sanj? So no, this tool is here, yeah, is for normals. We are going to be launching an abnormal management tool next year. So this is the principle behind this tooling, is to manage and file all of your normals and run additional patient contextual checks on your normals, and the time saving come from there. Can you set different, next question, can you set different range actions for results and no history? So can you set a different range action for results, e.g. HbA1c 42 and no history of diabetes or prediabetes, and file or 42 to 47 with a history of prediabetes, then allow it to file these? Sanj, you answer that question?
No, for this one you can't do that. You would set the initial range, and yes, you can't do the multiple ranges in terms of different actions. That would be in our next module.
So the thing is, the way to think about this is this is to look after the normal. So you would see which one is going to save you the most time. Essentially, you have one set of rules per pathology test. Per path test. So you would look at HbA1c and you would say which are the tests I don't need to see, and then you would give MyBotGP permission to manage those, and it would omit the rest, and you would see the ones that you do need to see. So with this example, if you presumably you'd want to see the people who have pre-diabetes, so you would still see those, but the ones that you don't, you won't, and the tooling will do the checks to determine that and file it for you in the background. How does it flag for clinical review? What does it look like in EMIS? The path tests are left in EMIS for you, and there's a marker in there. Radiology is an interesting one. In principle, yes. Pick up keywords. We haven't seen that many clients use it. They're just starting now, but yeah, 100%. The keywords are searched for in the active problem list. What are they in the past or deactivated? Funnily enough, we had this question earlier on today. It searches everywhere. There's an additional safety to search everywhere. We were advised to do that because sometimes codes and lists are out of date. So someone may have had a health condition and it may not have been coded. And a lot of the time, the clinicians would still like to be made aware of that. So it does a blanket search for that keyword to make sure that person doesn't slip through the net. What about a pregnancy and pediatric result? I'm not sure what that means. Would you mind popping a bit more of an explanation on that one, Sanjeev, and then we can circle back to that one, unless my Sanj. Unless you know what's meant by that.
No, if you can give a bit more info, yeah, not sure on that one.
Okay, thank you. So if a report comes in and it has multiple items in it, e.g. our UNDs, LFTs, lipids, and THA and TSH all come in one report, How does the system manage these? Will it leave the whole report or file some but not others?
I can say that, yeah. So it's based on your clinical system, the constraints of that clinical system. So within the EMIS, what it would do, all would have to be normal within that multiple for it to file normal action for all of them. If one of them was abnormal, they would all be left for review. Whereas within SystmOne, you can file singular tests within a multiple. So again, within SystmOne, it would actually file the ones which are normal and leave the ones which are abnormal.
Thanks, Sanj. When the bot sends an SMS to patients, does it use Accurix or Health Hero or another provider? And is there a fragment cost to this? It will use Accurix, and it will use Accurix in the same manner that you are using Accurix at the moment. So you will pay the cost for it. And that's a good point, because I think what a lot of people aren't aware of at the moment is there's a massive push to use the NHS app. And what we're starting to see and what we're hearing through colleagues and steering groups that we form part of is that notifications through the app, along with increased uptake of usage of the app, means a lot of these costs will start to disappear, and things like SMSs and additional cost for messaging will be removed. Our tool is capable. It syncs directly with, nothing comes out of EMIS, nothing comes out of SystmOne. So when a patient logs in, they will see their path tests in exactly the same manner. So I think in answer to that question, just try and hold on a bit longer with these big additional costs for SMSs and stuff. I know ICBs aren't covering them as much, as coherent as much as they used to, and we believe these small problems will disappear shortly with higher usage of the app. And our tooling obviously is able to do that. But as of today, it will use Accurix in the same way, and you would pay for the messages. So sometimes prediabetes is coded as impaired glucose tolerance, non-diabetic hypoglycemia, impaired glucose, etc. Do you have to put all of those keywords area to cross-check against those conditions? Yes, is a short answer. Yes, you would. And we will help you configure those. And that's a very good question. And that links back to that tracker whereby you can tell it to look for multiple health conditions. What does the system, when does the system run? Is it running 24/7 or does it do it at set times of the day? So it has different intervals throughout the day. It will log in and out usually around 3 times a day. So we'll clear them in the morning, afternoon and the evening, which is normally enough time. Once it logs in, if you are a larger practice, you will probably have more path tests, so it will spend a bit longer. A smaller practice will have fewer, it will spend less time, but it will empty what it's seen. And this comes into the onboarding stage. Once you start using a tooling like this, at practice level, it takes a bit of time for the doctors to adjust and stop. Try not. It's like not looking at Instagram. Stop clicking the button to go and check the path test. Have to build some confidence that this stuff is being done in the background. And what we see a lot is at the beginning, MyBotGP and the clinicians are competing with each other to file pathology tests. And then as confidence builds with the tool over a few weeks, then you see the clinicians slowly stopping filing them, and then it moves to being stable to them. To managing the bulk of them, because the doctors know they've now seen it in reality. They know they're going to come in and the path tests will be done, and they don't have to worry and do them manually. So just trying to break a habit that's been done. But the whole point of the tooling is, why would you have your most skilled resource opening path reports just to double check numbers, get calculators out to work out differences, and then go back and double check for health conditions? MyBotGP will do that work for you, and it will make sure that when you look at path tests, you're looking at abnormals. Obviously, we're looking at cracking abnormals as well later in the year, early next year, or you're looking at normals that have been flagged, and all of the manual repetitive filing, which quite frankly is not something that you should be forced to do, will have been removed and done for you. And obviously enforced rules, enforced standardization. Doesn't matter when people are on holiday, doesn't matter if different people are looking at the path tests, you can have them all done in a standard way. So Sanjeev's question again, does it deal with pregnancy and pediatric results, or are they excluded and flagged?
So every path test is stored within MyBotGP, and the way to think of it is you've got around 5 rules that you can file any path test. So you can file it using ranges or a collection of keywords. So again, with those pregnancy and pediatric results, I'd sort of turn it the other way. Within the rule set, are you able to file it based on a keyword or a range? Because if you are, then you can then you just simply add in the rules, and then MyBotGP will file. But in terms of MyBotGP, it will store it as a valid path test, just similar to what James showed in that sort of 200 path test spreadsheet. It would be stored as one of the path tests, and then you'd give it the rules, and you'd think of what is your standardized rule set to file the ones that you don't want to see with respect to those two results that you stated.
Thanks, Sanj. I was just having a quick look on the spreadsheet, and there are pregnancy-related path tests listed on there. Can messages be sent via email using MyBotGP? There's no reason why they can't from our perspective. It's more a question of whether, so there's another good question, it's more a question of whether you are comfortable doing that. So in principle, there's no issue with MyBotGP triggering emails. But stuff to think about at practice level is in exactly the same way as when you send text messages, you will have a responsibility to reconcile and validate whether they are valid email addresses, whether they've bounced, how many emails that you send. So there's a big piece of work off the back of that, and that's why a lot of people are quite nervous around using emails. I mean, there's some really comprehensive systems out there like Accurix, for argument's sake, where you can build out a report, see whether the mobile numbers are still valid, see if you have a mobile number for the patient, see if the text message was delivered, rather than going back several years where people would send out 1,000 emails or 1,000 text messages and not really have the ability to track and see whether they were even delivered. Because obviously your responsibility is to inform the patient. So emails are really interesting, and that's why I steered away from mentioning them before and referred it back to the app, because I believe that the way things are moving at the moment, and with the investment that's going into an NHS app, that really is going to be the conduit. Obviously, not everybody is using the app yet, but I know there is a big shift towards doing that. So a long way of saying it's doable. But I'm not sure whether you would be able to do that at practice level unless you can reconcile that that they're actually being delivered and they're being opened and all the email addresses are valid. So I'm just going to go back to the brochure very quickly, and then we can circle back for some more questions. Sanj, can you see the screen? Yeah, okay. So just before we go back to pricing and stuff, we like to keep things quite simple here. So final slide is just to reconciliate, a reconfirm of what we started with. This tool is classed as a medical device. We are the market leaders in this product by far. This is a mature, robust tool that is already processing thousands and thousands of path tests a day across the country. This is not a brand new tool. This has been around a while. We have a DCB 01 certificate, 0129 certification. Our safety officer, UK practicing clinician, has drafted a DCB 160, which is the other half of this certification, which more than welcome to have. All of our clients are more than welcome to have. It's a template because you might want to tweak it a bit. All our kit resides in NHS Cloud, which is why we can have that logo there. So DTACs, DPIAs, data sharing agreements are all very straightforward. In principle, all we need is a username and password. You would set up an account for EMIS or SystmOne, give it permission to only look at path tests as you would if you're employing a new person. MyBotGP will log in securely, and it will do the work for you, and it will log out again when it's finished. And this is just a bit that we have to put on here. We're a graduate from a Health Innovation Network Launchpad program several years ago, government-funded program for helping companies with their cool ideas get them delivered at scale in the UK in tech. Final slide is around costing. Looks super complicated, but it really isn't once you've done it 50 times. This is 8,500 list example that we circled back on at the beginning if you think of the business case. So this 8,500 list is about 3,887, well not about, is 3,887 plus VAT per year, annual subscription, unlimited pathology tests, unlimited volume. So you could have 200 different pathology tests and it could be looking after 60,000, 40,000, 300,000 make a difference pathology test results. There's no additional cost. You can log in and out every day, you can change rules, you can change processes, no additional cost. Works out about £75 a week pretty much for this 8,500 list, and that's to get back 1.5 days a week of clinical capacity for this 8,500 list. and obviously have the enforced rules across the board. So we'll send specific quotes and prices for different practices if they would like that after the call. But in principle, the way the model works is it's 749 and then your list times 30 pence. So 749, excuse me, list times 30 pence. And then either 5 increments of 5, 6 or 7 pence based on how many patients you have. So up to 10,000 is 7 pence, 10 to 15,000 is 6, and 15,000 up is 5. Pretty straightforward. 8,500 patients, 3,887 plus VAT, 1.5 days a week, clinical capacity given back to the practice is about £75 a week. So hopefully we have everybody's emails. We'll share this recording afterwards, so we really need to spend too much time on the how to contact us slide. What I would like to do now is stop sharing again and see if we have some more questions. So if anyone has any more questions. Okay, so we're back on here. So if anyone has any questions, you want to just pop them in the chat quickly, and we can talk them through now. I'll just hold on a second for anyone that wants to type in. So really keep an eye on those. So let me know if any questions pop in. Thank you. Let's do a very, very quick summary. It's about 10 to just before 10 to 2, so we've got through in good time. Pathology management automation platform, super easy to plug in, quick to configure, can be bespoke. You can agree national protocols, labs, 100%. Anything that you would like to supersede, you can supersede if you want to. Again, up to you. In addition to that, we can read pathology test reports as well. So you can pick up warnings, keywords, path tests without ranges. The principle behind this tool is a massive security filter and time-saving filter at the front of your practice. Just because your normals, people think, how can you have a tool that files all normals? Well, you can if it double checks they're normal, and that's what our tool does, and it ensures nothing slips through the net. All of the groundwork around picking up path tests, validating path tests, filing path tests, running patient contextual checks on path tests is all done for you. So that will be a thing of the past, and you will have an inbox with abnormals. Yes, abnormals still need to be processed and take time. That's coming. But with all things technology-wise, especially in healthcare, you have to do these things in increments. Slowly add on. Otherwise, it can become unsafe. Jumping into something that's massively complicated as the first tool can be a recipe for disaster. Let's manage the normals, remove all of the normals, get you your time back there, and we will layer it up with phase 2. So these 62,500 path tests a year for this scenario, 50,000 just under come through as normal, 10,000 manual contextual checks, a waste of time. In addition to filing, not waste of time, massively important thing to do, but waste of time having you do them manually when they can be done for you in the background, in addition to filing everything else. Masses of clinical capacity allocated to this and cost. Masses of clinical time. Imagine 95 days of clinical capacity released at an 8,500 list. Massive time. Time adds up. Oh, a couple of questions popped in the chat. So picks everything up, validates, you can apply your rules, any combination of, or you don't have to. Coming back to the question earlier, you want to file everything that comes back as normal, then 100% the tooling can do that as well. Super quick to configure. And let me come back to the question. So I'm going to stop sharing. So here we go. So you mentioned plans for management of abnormal results in the future. Is there anything you can share about what that's likely to look like and when it will happen? Yep, that will be out hopefully later on in the year. Super complex tool. Pick up, run protocols, create tasks, manage normal abnormals and patients, individual tracking, all manner of different things, and that will generally be available to clients who've acquired this tool as an upgrade. Because it's going to be focusing only on abnormals. Are you able to predict how many tests per day it will automate per thousand patients? Interesting question. Yeah, we could divide that 8,500 by 8 roughly. And again, that will change slightly depending on the demographic of your patients as well, and how many path tests you are applying for. So we can give you stats across our client base, maybe after the call, 100%. But in principle, a lot of that will depend on how many path tests you're applying for and the demographic of your patient list type.
Yeah. So on that 1,000, exactly. So of that 1,000, how many are normal? So if that's 600 or 700 on that 1,000, and how many path test categories are enabled? So if you've enabled 100%, then all will be filed. If you've enabled only 80%, then 80% will be filed. So it's all based on what you've enabled and the rules that you've told MyBotGP to apply. So again, as I say, if you let it file all your normals and you've enabled them, it will file all of them.
It's a good question. Thanks, Dan. So we put 80% on the first page, on the front page. So out of that 1,000, it would be 800. We're being told by clients that figure is closer to 90, but we keep it at 80. So 80 to 90%. But again, as Sanj says, if the tooling's been given permission to do the initial vet, it's going to screen 80 to 90% of those, 80 to 90, so 800 to 900. It may run patient contextual checks on up to 200 of those path tests as well by itself, and it will file the ones that don't need patient contextual checks, and then after the patient contextual checks, it will file the percentage that passed and not the ones that have failed. So it's also doing the work to show those as well. Trial periods, no. This is a super mature product. This is it's a super mature product now. We've got multitude of references. It takes time to set everything up. I missed earlier. Could you clarify if results come in bulk? Depends on the system. Yeah, Sanjay.
Sorry, go on. Yeah, no, it depends on the system.
Yeah.
Do you want to take it? You take it.
No, you take it.
Okay. So for EMIS, it will basically, if one of the tests is abnormal, it will leave the entire multiple because it's a system constraint of EMIS. If it's SystmOne, it can file them individually as part of the multiple. If anyone's a normal, it can file.
Any more questions? We've got a couple of minutes left. We can hold on a couple of seconds longer. So while anyone puts some more questions in, what we will do is it'll take us a short period of time to tidy this up and get this onto our website. We take the recording, tidy it up, put it on our website, on our webinar page, and then we will share a copy of it with everyone as well. So it looks like there's no more questions. So thank you for joining. And yeah, any questions, let us know. And if not, we hope to see you soon. And thank you. Okay, bye-bye. Bye-bye.